Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board certified allergist and immunologist. Today's episode focuses on another widely used over the counter oral antihistamine that is especially relevant during allergy season. If you or someone you care about has questions about dosing, available formulations, or whether this medication might be a good option, this video will be helpful, particularly if you have not tried it before. And that is Zyrtec, one of the allergy drugs I most often hear patients mention in clinic. In a previous episode, I've reviewed Zyrtec in detail, which is closely related to Zyrtec. If you're interested in Zyrtec, you can check out that video linked above. But today, we'll talk about Zyrtec. In this presentation, I'll walk you through 5 key things you need to know about Zyrtec: its indication, how it works, how to use it, important warnings and precautions, and its safety profile. And if you're new here, don't forget to subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Zyrtec and who it's for? Zyrtec is an oral antihistamine that contains cetirizine. The over-the-counter formulation is approved for 2 main uses. First, it helps temporarily relieve symptoms of hay fever or other upper respiratory allergies, such as runny nose, sneezing, itchy or watery eyes, and itching of the nose or throat in adults and children 2 years of age and older. Second, it is used to reduce hives and relieve itching due to hives in adults and children 6 years of age and older. Zyrtec has a long-standing regulatory history. Its prescription form was first approved by the FDA in December 1995, with pediatric expansion in October 2002 to include children as young as 6 months. In November 2007, it transitioned to over-the-counter status, making the same active ingredient and strength available without a prescription. It is worth noting that while the prescription version is approved for children as young as 6 months, the over-the-counter labeling is more limited, approved for age 2 and older for nasal and eye allergy symptoms, and ages 6 and older for hives. For children younger than the labeled age, a doctor should be consulted before use. Second, how does Zyrtec work? The active ingredient in Zyrtec, cetirizine, is an antihistamine. It works by blocking histamine, the chemical released during allergic reactions that can lead to itching, swelling, inflammation, and increased mucus production. It's also important to set expectations. The onset and degree of symptom relief can vary from person to person. Based on clinical studies, Zyrtec typically starts working within about 1 hour after the first dose, and its effects can last up to 24 hours, supporting once daily use. Third, let's talk about how to take Zyrtec. Zyrtec is available in several formulations, including tablets, orally disintegrating tablets, chewable tablets, liquid-filled gel capsules, and liquid. Tablet strengths are commonly available in 2.5, 5, and 10 milligrams, and the liquid formulation is 1 milligram per 1 milliliter. For adults and children ages 6 to 64, the recommended dose is 5 to 10 milligrams once daily, depending on symptom severity, with a maximum of 10 milligrams in 24 hours. For adults 65 years of age and older, the recommended dose is 5 milligrams once daily, which is also the maximum for this age group. For children ages 2 to 5, the recommended dose is 2.5 milligrams once daily for relief of nose and eye allergies. If needed, this can be increased to a maximum of 5 milligrams per day, either as a single dose or divided into 2.5 milligrams every 12 hours. Do not exceed 5 milligrams in 24 hours. For younger children, the liquid formulation is more suitable, as it allows for more accurate dosing and may be easier for those who have difficulty swallowing tablets. Extra caution is needed in certain situations. Patients with liver or kidney disease should consult a doctor before use, as a lower dose may be required. If a patient is pregnant, a healthcare professional should be consulted before use. If breastfeeding, Zyrtec is generally not recommended. Fourth, let's review the warnings and precautions. Hypersensitivity reactions, including anaphylaxis, have been reported with Zyrtec. Patients with a known allergy to cetirizine, any of its ingredients in Zyrtec, or hydroxyzine, a closely related antihistamine found in Vistaril and Allergy, should avoid use. While Zyrtec can treat hives, it is essential to recognize when symptoms become more serious. Seek emergency help right away if hives occur along with other symptoms, such as trouble swallowing, dizziness or fainting, swelling of tongue, swelling in or around mouth, difficulty speaking, drooling, wheezing, or breathing problems. These may be signs of severe anaphylaxis, which can be life-threatening if not treated by a healthcare professional immediately. Symptoms of severe anaphylaxis may develop when hives first appear or up to a few hours later. It is also critical to note that Zyrtec is not a substitute for epinephrine. If you have been prescribed an epinephrine product for anaphylaxis or allergic reactions, do not use Zyrtec as a replacement. You should carry your epinephrine with you at all times. Ask a doctor before use if your hives do not itch, appear unusual in color, or look bruised or blistered. Stop Zyrtec and consult a doctor if hives do not improve within 3 days of treatment or last longer than 6 weeks. Zyrtec should not be used to prevent hives from known causes, such as foods, insect stings, medications, or latex. Avoiding the trigger is the most effective way to prevent hives. If the reason for hives is unclear, your doctor may be able to help identify it. Compared to older antihistamines like Benadryl, Zyrtec is less likely to cause drowsiness. However, some individuals can still feel sleepy. Do not drive, operate machinery, or perform tasks that require alertness until you know how Zyrtec affects you. And avoid alcohol or other sedating medications that may increase drowsiness. Lastly, in May 2025, the FDA issued a warning that patients stopping the oral allergy medicines, cetirizine or levocetirizine, after long-term use may experience severe itching. Although rare, this is something to be aware of. For more details, please refer to my previous episode, link above. And finally, let's talk about the side effects and safety. In clinical trials of adults and adolescents ages 12 and older, the most commonly reported side effects included drowsiness, fatigue, dry mouth, sore throat, and dizziness. In children ages 6 to 11, commonly reported side effects were headache, sore throat, abdominal pain, cough, drowsiness, diarrhea, nosebleeds, breathing problems, nausea, and vomiting. In children ages 2 to 5, the safety profile is generally similar to that seen in children ages 6 to 11. Overall, most side effects are mild to moderate and uncommon, occurring in 5% or less of patients, with many reported at rates close to placebo. Drug discontinuation due to side effects was low and comparable to placebo. After approval, additional adverse events have been reported through post-marketing data. Although it is hard to determine how often these occur or whether they are directly caused by the medication, these reports highlight the importance of stopping Zyrtec and consulting a healthcare provider if new, persistent, or worsening symptoms develop. And there you have it, 5 key things you need to know about Zyrtec, a once daily oral antihistamine that is readily available over the counter and helps manage allergy symptoms. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experiences in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.